Welcome to our panel on leadership strategies to promote health equity. I'm Trudy Sullivan. I'm Health Catalyst's Chief Communication and Chief Diversity, Equity, and Inclusion Officer. At Health Catalyst, we're dedicated to driving massive, measurable improvements in healthcare using data, analytics technology, and services. We're extraordinarily proud to be the sponsor of today's discussion on health equity. With us today, we have two teams of panelists. From Common Spirit Health in Chicago, we have Rosalind Carpenter, who is the Chief Diversity Officer and Systems Senior Vice President. Joining Rosalind is Lloyd Dean, Chief Executive Officer. From Christus Health in Irving, Texas, Marcos Pesquera, Chief Executive Officer. Marcos Pesquera, System Vice President of Community Benefit, Health Equity, Diversity, and Inclusion from Christus Health joins us, and Ernie Seydoux, President and Chief Executive Officer of Christus Health. We invite the audience to join the discussion with questions for the panelists, and you'll be able to submit your questions through the panel on the side of the screen. So with that, let's get started. The first question is for everyone on the panel, and it is, what is the path forward to address health equity for your organization? And I'll go ahead and start with Lloyd.
Thank you, Trudy. Solving the needs of the poor and the vulnerable in minority communities is a fundamental, not only focus, but a fundamental of our ministry. We are particularly focused on 5 areas: expanding access to care, particularly in underserved communities. Secondly, improving how we track outcomes, specifically by race, clinician training, expanding programs that impact the social causes also of poor health, and finally, further diversification of our leadership, our workforce, and our suppliers. And I would encourage us to think about for a moment that health disparities cost our economy $90 billion in excess of medical costs and more than $40 billion in lost productivity. And I spend a lot of time, and I hope that everyone listening at this call, to thinking about how we could better use those resources to expand access to healthcare, to improve nutrition, and to develop the skilled workforce that we know we all need. Let me now turn to Rosalind.
Thank you. At Common Spirit, we're driven on a path forward, driven to respond as an organization and as a team of over 150,000 individual caregivers and clinicians. I believe that we have a unique responsibility, as well as an opportunity to leverage this moment to advance health equity. We're taking specific steps to proactively impact the systemic inequities that we know exist and that we know is experienced by poor, vulnerable, and communities of color. We've convened through our Office of Diversity, Inclusion, Equity, and Belonging a cross-functional team to develop a 2-year Common Spirit Health Roadmap for health equity. We have specific actionable priorities that will be implemented across functional areas driving health and healthcare. Our health equity roadmap results in expected outcomes of a more equitable organization, strong data systems to drive decision making for our employees, our patients, and community interventions, as well as expanding equitable clinical protocols to address health equity, behavioral health services, and culturally competent care. We're focused on actionable programs and initiatives to improve health outcomes and to deliver those healthcare outcomes in a more accessible ways, especially for vulnerable and underserved populations, so that we can expand culturally competent care and build even more community partnerships.
In relationship to Christus Health, we've obviously, I think, to understand the path forward, we have to spend some time talking about where we've been. And about 9 years ago, we established, whenever I became CEO, one of our three major strategies with an intentional focus on the strategy of enhancing our culture of diversity, inclusion, and health equity. And that really set the framework of how we have continued to develop health equity, diversity, and inclusion throughout the entire One Christus culture. And then we established the department. And obviously, even though Marcos is now the CEO of Christus, he has been leading that department for a very long time and helping us establish and working together with the CEO from that standpoint, our entire focus. This last year, one of the most critical things we did as a ministry was train all of our leaders throughout all of the entire Christus Health ministry, both Latin America and in the US, on unconscious bias training. And with some of the challenges that we are facing as a country and as a world in those areas, that has been extremely critical to establish that common language and that foundation for who we are and what we expect out of our leaders within Christus Health. That has also established a common open door and platform in how we deal and enhance our culture in the conversations with racial justice too. I would like to have Marcos talk about our three major priorities that we're working on now, which is obviously our enhancement in health equity, our growth in our culture with diversity, and then how we make our community benefit investments to ensure that the vulnerable and the poor are continuing to receive high quality, equitable care no matter where they access a Christus Health ministry.
Great. Thank you, Ernie, for the promotion. I appreciate that. Remember, it's recorded. So the path forward, as I see this, it's ever changing because we have to be very nimble to be responsive to the needs. It reminds me of a teacher that always tells her students in a test, hey, take your time answering the test, but hurry up. So it's kind of that paradox, if you will. So in the three areas that Ernie just mentioned, the growing on a culture of diversity and inclusion, we have a high emphasis on the hard work of introspection and the internal reflection from all leaders, because we really want to get to the root of why we are where we are. And the whole work of unconscious bias and understanding how our own biases affect our decision-making processes is not something that's going to happen quickly, but it's urgent. We need to do it. As a result, we have put like a racial justice educational campaign through our educational platform for all of our associates and leaders to have access to. We put in there some of our trainings that we've done around brave conversations on race, or we even have a book club right now that we're having on Ibrahim Kendi, How to Be an Anti-Racist, which is kind of interesting how that book has even helped us to create a group that's going to start looking at policies through the equity lens. And of course, having equity of care and D&I as part of the goals in the strategic map. That has to be. And then on the equitable piece, we address it from different areas, but physician engagement has been great in terms of looking at quality indicators by race and ethnicity, helping us with the training, social determinants of health assessments, the clinical practice, and continuing to look at community benefit now with that equity lens when we report, so we can really pinpoint our efforts where it really counts.
That's great. Thank you, all of the panelists, for the responses, and the path forward looks bright. And Rosalind, before I move forward, let me know if you'd like a promotion too, and I'll try to help out. The next question that I have is for our Chief Diversity, Equity, and Inclusion Officers, and it is, as we've seen a really significant rise in the hiring of this position, do you have any advice for the best ways to work together with your CEO and your C-suite colleagues to drive change? And let's start with you, Rosalind.
Well, thank you so much. As Chief Diversity Officer, my role supports our entire C-suite and executive leadership team, of which I'm a member. The advice on how to work effectively with C-suite colleagues is to do so collaboratively. I suggest that CDOs and those spearheading diversity and inclusion work be intentional to work well with others. We do this in a number of ways. For example, I lead an executive D&I leadership council Lloyd Dean is our executive sponsor, and our council is made up of both national and market leaders who are committed to championing this work. They share ownership in modeling and progressing diversity, inclusion, equity, and belonging across our organization. And I work to see that my C-suite colleagues and others see our work as a necessary element, a business imperative, a critical and needed leadership voice, and a valuable partnership, helping to solve the needs of our organization and the communities that we serve. So our collaborative nature even extends to our board committees. We have a Health Equity and Inclusion Council, as well as sit on a number of functional area committees to partner with those seeking to solve the needs of our business. Our Office of Diversity, Inclusion, Equity, and Belonging has 3 focus areas. 1, promoting a workforce that represents the diversity of our patients and cultivating an equitable and inclusive environment for all. 2, ensuring that health equity is embedded across our sites of care and services. And then advocating for healthy multicultural communities, removing those barriers to health and addressing systemic racism in how we partner with others, how we conduct our business practices, and how we help to lead our nation in achieving health equity for all.
Thanks, Rosalind. I do agree with you. Collaboration and advocacy are so critical. Marcos, what are your thoughts?
I think for me, frankly, I knew from the first day that I came into Christus that I had open access to the CEO. I think this relationship is really, really critical for this agenda to be successful. And as you know, I don't know if you know this, but I'm not the Chief Diversity Officer. Actually, Ernie is. And I'm good with that because, frankly, this agenda has to sit in the highest level of the organization, and it communicates volume. So the reason for that to me is the root of why, as an industry, where we are, it's because these issues are really deep, and we have to be extremely intentional to do the work that is needed within ourselves and then call others to do that. So what would I suggest? I think as a CDO, meet with your CEO regularly, at least quarterly, if not more than that. Ensure that diversity and inclusion and health equity are part of your organizational strategy, and there's goals there with metrics to achieve success. Make sure that, as you meet with your CEO, it kind of happens fluidly, where you're going to the CEO cabinet meetings to discuss things when appropriate that come up. And even to be able to have the openness to have open discussions about disparate points of views without judgment. I think that's really important. And you have to be able to explain the importance and the value of health equity, diversity, and inclusion into operations, into quality, to the medical group, to procurement, to HR. I think what Rosalind shared about the CEO chairing your Health Equity, Diversity, and Inclusion Council is key. And using that office once in a while, because it gives the message the right priority.
Thanks, Marcos. And it's definitely critical to have the CEO intimately involved and supportive and visible. And so that's a nice kind of segue to another question. And we'll start with Lloyd about the value that you see in the relationship with your Chief Diversity Officer. Maybe you could just share some perspective with us.
Yeah, I think that the value in the relationship that I have with Rosalind and her office is immensely important and critical for the journey that we at Common Spirit Health are on. One of the things that has always been frustrating to me is that I hear leadership and I hear CEOs and COOs talking about the importance of diversity, but it is pushed way down somewhere in the organization. And so, as you know, Rosalind reports directly to myself. As Rosalind said, she sits on the most senior leadership group that we have, the executive leadership team in that structure. And I think this positioning sends a message throughout the organization that we are not just paying lip service to the importance of diversity, but that throughout all of the levels of the organization, it is critical. Rosalind also attends the Board of Stewardship and Trustees meetings and regularly speaks and engages with the board. And I'm very proud of the relationship. And we meet often. We call each other on weekends. And it's not just about specific agenda items that are going to be on a particular committee or the board. But as we are dealing with day-to-day business issues, having that perspective, having that voice, having that sensitivity, I think helps us put the right kind of push, the right kind of efforts, and the right recognition that we are serious about diversity, we are serious about inclusion, we are serious about equity.
Thank you, Lloyd. It sounds like a dynamic and powerful relationship that you and Rosalind have, and I'm eager to hear, Ernie, about your perspective around the value of the relationship with your Chief Diversity Officer.
Totally echo what Lloyd's shared, obviously, because I think that's critical. The relationship together of the CEO, the Chief Diversity Officer, the executive that's leading that together with you and the team is critical. You have to be aligned together as leaders that are leading this in the organization. And it's not just about Marcos and myself, and we are not the only ones who just have that accountability in Christus Health, but we hold others accountable and are aligned in that vision of how we hold everyone within the Christus Health ministry accountable for moving our culture forward in health equity, diversity, and inclusion. And so for me as a CEO, it's critical then that Marcos and I have trust for each other in everything that we do, and that because of that trust, we have that foundation, as Marcos mentioned earlier, of really being able to have robust conversations together, just one-on-one, that have really enabled Christus Health to move so much forward in all these areas of health equity, diversity, and inclusion with no judgment. I can talk to Marcos about anything, and I have the confidence and the trust in him in that conversation that he holds no judgment to me for some of the things I may say or the things that I'm wanting to learn more about or understand more about what's really occurring in a specific ministry within Christus Health. And so it's how we problem solve that and hold that, dear to our relationship, and the access that we have with each other is very, very important. And we keep it at a very high level throughout Christus Health as that priority.
Thanks, Ernie. I love the concept of no judgment. We often talk about it in the diversity practice as giving one another grace as we grow together and learn together. And it sounds like that's a beautiful dynamic of your partnership. So thank you for sharing that. Now let's pivot a little and talk about the fact that COVID has shined a very bright light on the disparities that exist in care. And I'm curious, with respect to Marcos and Rosalind's thoughts on any work that you've been able to do to address the diversity and equity and inclusion opportunities that bright light that's been shined on COVID has provided. And so maybe we'll start with you, Marcos.
All right. Well, this is no surprise. And I think as long as I know myself and Rosalind, we've been working at this is no surprise what we've seen. However, it did give us an incredible opportunity for open dialogue and bring this agenda forward. I mean, listening to our own associates and colleagues, their own stories and personal things, it really was life-giving. The messages that we have heard, and also this is also provided an opportunity for our physicians to get involved. I see a lot of energy there because they want to be part of the solution in terms of eliminating health disparities. We were early adapters of the Equity of Care pledge from AHA, and we do trust our data. So we have looked at our COVID diagnosis. We stratified by the race and ethnicity, and the data that we have in our own backyard is no different than what the community is experiencing as well. So we're actually looking at that and stratifying that. Also combining this community benefit work, as I had said already earlier, that community health worker structure, many of our community benefit structures have that. And it's so critical for equity of care work to have that in terms of language and culture and individuals that live within the communities. Is good. And then we already had an equity of care program going that was primarily focused on minorities and other vulnerable communities that were utilized in the emergency department for primary care. And what we did with COVID is we redirected that to use those care navigators and community health workers through a partnership for remote patient monitoring to give the appropriate resources to this vulnerable community so they can quarantine successfully. So this work kind of prepared us for we knew what was coming.
Thanks, Marcos. Yeah, the socioeconomic determinants of health are good drivers, and the data doesn't really have an opinion. It just points us in the right direction. So thanks for sharing what's going on. How about for you, Rosalind?
Well, for us, there's been many illuminations for 2020, but it has really allowed us to do a couple of things. One is really to double down and focus on health equity. We've convened, as I mentioned earlier, a cross-functional team, and we're developing a 2-year roadmap for Common Spirit Health. And for us to be able to bring those functional groups together that drive health and healthcare, which includes advocacy, philanthropy, our strategy folks, population health, community health, physician enterprise, quality, data, culture, all coming together to create ways that we can work better together, knowing that we will significantly expand how we track our outcomes by race, looking at how we can require additional clinical training, how we can expand access points for care, and particularly to focus on the social determinants of health. All of this has illuminated the need to do more, and we're doing just that. And one of the really wonderful opportunities we've had is to engage ourselves across our ministry, having meaningful conversations, allowing ourselves to be vulnerable and talk about what's going on. I think that it has brought us together in a closer and more powerful way that will aid in the results and the impact that we will make.
That's great, Rosalind. Thank you. A lot going on, and I'm really excited to hear about all that you've been able to do in a short time, and in a variety of different settings, which leads to my next question for Lloyd and Ernie. Maybe we'll start with you, Lloyd. I know that in both of your organizations, you have both large and small hospitals, and I'm curious as to how you see the work differing or being similar in those different environments, and are there different ways in which you offer support to your teams? Just wanted to hear a little bit about that.
Yes, one of the reasons why we have both, as you mentioned, urban and small rural hospitals and access points is that we are committed to serving all who need care. And Common Spirit Health and our legacy founding organizations have a long history of addressing inequity and disenfranchisement in different communities. And one of the benefits that I think scale offers is that we can take best practices, we can take learnings, we can take resources and easily migrate them to different communities of different sizes. Yes, some of the dynamics and some of the profiles and some of the, if you will, architecture of our rural communities are certainly different than our urban communities. But one of the things that we've learned, and in partnership with, example, the Robert Wood Johnson Foundation in the United Way, is that there are many common elements that we see in urban communities that are impacting rural communities. So while the magnitude and the complexity of the solution might be different, we see many similarities from one geography and one community to the other. And finally, our approach is to work with community partners. regardless of the size. We can't do it all ourselves. So understanding and helping identify through a community needs assessment what each community needs, and then addressing those needs specifically and with solutions that are applicable to that local geography, we have found that's where we get the greatest success. So we don't spend time going small community, urban community, rural community, urban community. We focus on what does that community need and how can we, hand in hand with other members of the community, help meet those needs.
That's fantastic, Lloyd. Thank you. And it really does take a village. So it's great to hear about the power of the partnerships that you're establishing in local communities. And Ernie, how about you? Maybe you could share your perspective as well.
Sure, I'd be happy to. Very similar to some of the comments that Lloyd shared, but it's extremely critical. We don't hold any difference on whether you're a rural provider, a small critical access hospital, or a physician clinic in a very small community, or you're in Colombia or Chile or Mexico. We set our direction, obviously, with our councils that we have, our Health Equity, Diversity, and Inclusion Council that represents all of our ministries throughout Christus Health, and then also our physician task force on health equity that we have, and work together in providing that common direction and strategies of what are the accountabilities, what are the goals going to be overall, based upon what we see throughout all of Christus as the community needs in various areas and how that's addressed. And the beauty of being a part of a medium or larger health system is that then, yes, there are certain resources that may not be available in a rural facility, but then we complement that as a team within the system office through Marcos's department or whatever other resources we need to do to ensure that that's not an excuse. These are the community needs that are needed, and through our values, then we address those and we implement and partner with community partners or other healthcare providers in those small communities to ensure that health equity isn't about where you live, it's in total. It doesn't matter what country you're in or wherever, where we have a Christus Health ministry. This is our priority, and it's health equity is number one for everyone, no matter what. And so that's really been sort of the foundation. So we complement those resources. We hold it as a critical factor of who we are as Christus Health.
Thanks, Ernie. Thank you. And thanks to the panelists for sharing such great input up to this point. I know for me, the wheels are really turning. So I imagine that's probably true for our audience as well. So I wanted to let the audience know that you can submit questions for the panelists, and you can do so, submit those questions through the panel on the side of your screen. Thank you. Okay, now we're going to take questions from the audience, which I think is going to be really exciting. I want to thank the panelists again for their thoughtful insights and perspective. And it looks like the questions are coming in hot, so I'm not going to waste any other time. I'm going to jump to the first one, which is about career advice. Folks want to know if you're interested in making a difference with equity and diversity and inclusion and belonging. Do you have any tips? And I thought and how do you get started, I guess is the question. So I thought it'd be great to start with Rosalind and hear maybe a little bit about the competencies that you think are necessary for success.
Trudy, thank you for the question. A few years ago, the Institute for Diversity and Health Equity, they convened a group of maybe 20 chief diversity officers, and we talked about the competencies that are required to be effective in this role. And it's about 8 of them. So 1, strategic visioning. 2, change management. Political savvy, persuasive communications, and ability to navigate clinical settings and sites of care, as well as the ability to have an innovative DNA. Cultural intelligence is key, as well as credibility.
Fantastic. That's a lot, a long list, and a lot That's a long list and a lot to manage. Appreciate your perspective, Rosalind. And Marcos, maybe you'd want to talk about your journey to this position and perspective you might share from your experiences and experience gained.
I think in terms of what my career has been a little bit different than usual, if you will. I mean, I started working as a pharmacist and then move into administration and move up from that ranks to what I'm doing now. And what I would advise somebody that wants to get into this work is start where you're at and be committed in your sphere of influence to ensure that you're implementing these programs that your organization is sponsoring and promoting. So start with that. You know, Rosalind talked about all the what's needed in terms of the skills and competencies, but you gotta love people and you gotta be a great listener too. And the other piece that has helped me as my career was very clinical and then switched to this, which is a little different, is listen to your leaders. People will tell you what you're strong at. People will tell you what you're going to be successful at, and just kind of said, okay, immerse yourself in it, and kind of let's see where things take you. And that's really that's been for me.
Thanks, Marcos. So Ernie, would you want to just share some perspective about what you think is critical to get this kind of work started from your vantage point as the CEO?
Yes, as far as just getting the health equity, diversity, inclusion work started and the skill sets you need in those areas, I think have basically been mentioned here already. But I would also add that in order for us to be successful in that area, or you to be successful in that area, you really have to have that passion and be able to influence others to make a difference, to really have that commitment. And if you have those two major skill sets also, or the desire, then it definitely will continue to add to your success as a leader in health equity and diversity and inclusion.
Thanks, Ernie. Lloyd, anything you want to add before we move to the next question?
Yeah, I would just add the following observations. Number one is I think that Rosalind has done an excellent job of articulating some of the skill sets. But I would ask us to think about too that those skill sets in many ways would line up against anyone in leadership. So I think it's about leadership skills. I think that to do this work, I'm very happy to see that some universities and schools are evolving to understand that there is a science to diversity and inclusion. So I think people from with an HR background certainly can evolve to this work from mission. Within, you have to understand the mission. You have to understand strategies. You have to be outcome oriented. As Rosalind said, you have to have excellent people skills. You have to be able to understand finances, because there are so many aspects of diversity and inclusion that will utilize resources, need resources. This is not something that one just does, because they're interested in it. You have to be first and foremost a good and well-trained leader, strong with great executive competencies and an executive profile. So I think it can come from the path to this work, can come from many, many different ways, but I think it has to be something that you're passionate about, but you have to be well trained. This is not a training ground position.
Thanks, Lloyd. And I know we're now tight on time. And so one last lightning talk style question for you, maybe one word. What gives you hope? Starting with Marcos.
Oh, wow.
One word, one sentence.
What gives me hope is that I have never in the past have been reached out by so many different people in different walks of life and demographics to really want to get involved in this work and be part of the solution. So this time is different, and I think it's full of hope.
Great. Ernie, what gives you hope?
I think with how COVID-19 and this pandemic that we're currently in, and the conversation of racial justice that has evolved to such a higher level now as leaders, what gives me hope is that it is on everybody's plate, and that it is extremely important to understand how equity helps you fulfill and be stronger as an organization. And we see those successes occur every day now. And so seeing that traction, and now all of us as leaders being able to build on that and build on those resources every day to where it is common in everybody's culture.
Perfect. Thanks, Ernie. Rosalind?
Trudy, I tell you what gives me hope is my CEO and the 150,000 employees that I work with every day, and the amazing way that we bring human kindness to the care that we provide to our patients, our employees, and the communities that we serve.
That's beautiful. Thank you, Rosalind. How about you, Lloyd?
I would use 3 words: truth, transparency, and courage. That we are, for the first time, on a global scale within this country, I think speaking truth about some of the root causes of injustice, inequities, health disparities. And I think if we can continue in that vein, because it's first to recognize and acknowledge the problem, I think we'll be well on our way to hopefully addressing with really actionable strategies and tactics.
Thank you, Lloyd. And thank you all. I think we're out of time, but I'm feeling hopeful, and I'm really grateful to all of you and to AHA for hosting this wonderful, wonderful conversation. I couldn't agree more with all of you around the opportunities that we have to drive change for every single patient on the planet. And I think the silver lining of COVID is that we've found a way to realize and embrace all the opportunities that are right in front of us every day. And I think that makes me hopeful. But hopefully what also leaves the audience feeling hopeful is that there's a tremendous team of folks here that are doing meaningful work that you can learn from. Transparent, courageous, dedicated, driven. All those things make a difference, and you've made a difference for me in this experience, and hopefully we've made a difference for all of the audience as well. So with that, thank you all for joining us.